Welcome everyone to the ADHD Now What podcast. And today we welcome Dr. Woeller from the United States of America. Welcome, Dr. Woeller. It's so lovely to be speaking to you today.
Thanks so much. Nice to be here.
We will be talking about ADHD. Now, symptoms of ADHD include inattention, hyperactivity, and impulsivity. In children with ADHD, their hyperactivity and inattention are noticeably greater than expected for their age, and this can cause a lot of distress or challenges with functioning at home, at school, or when they want to make friends with their peers. Kids with ADHD can present with constant fidgeting. They may be unable to concentrate on tasks for long periods of time. Sometimes we can see excessive physical movement or excessive talking. They may be unable to wait their turn, or they may act without thinking. Today, Dr. Woeller is going to be talking about some of the causes and treatments for ADHD. So Dr. Woeller, my first question is, what are the stats on ADHD in the US?
Well, it changes year to year. The Centers for Disease Control here in the United States, carries those statistics. Over the past few years, we're looking at probably over 6 million or more kids of various ages being diagnosed with ADHD per year. So, a fair amount. And I mean, it's, again, these statistics tend to shift around, but that tends to be, it's going up. So you're probably looking anywhere between 6 to 8, depending on a given year. But as of the past few years, that's what it's been.
I'm not quite sure about the stats in our country. I don't think we have a board taking accurate statistics, but I do know that the number of children with ADHD who are contacting my Catch Up Kids organization, where we assist learners with ADHD to cope in the classroom, especially the foundation phase. We're just getting more calls on a daily basis. And so I know a lot of our parents would want to know, what are some of the common causes of ADHD?
Well, I mean, they've looked a lot at genetics. I mean, so it's easy to blame genetics for everything, but there certainly is a genetic component for some, or at least what it does is it may increase the potential of developing it, and then you add other factors. So let's say maybe there's an underlying genetic tendency, and then you add on top of that environmental factors, whether it's food sensitivities, chemical exposures. So there's not one cause. Some of the others that they are investigating, and I've certainly seen in my practice, would be chemical exposures. I mean, it's certainly know that things like organophosphates and different insecticides can affect the brain adversely. We know that heavy metals, so lead toxicity has been a well-known contributing factor to this for many years. So that's pretty well established. Brain trauma of various sorts, so anything that's injured the brain, you kind of have to think about that from the standpoint of injury doesn't necessarily mean a blunt injury, like I hit my head. It could be a chemical injury. It could be some other kind of toxic injury, an inflammatory injury that might be occurring. Low birth weight is something that has been looked at and considered. Just overall poor nutrition, alcohol use, tobacco use, in moms who are pregnant, probably other medications that people are taking. So there's a variety of things that can contribute to it.
I love how you explained it. Injury to the brain, or it could be from an inflammatory response. It can be something chemical that triggered the ADHD. I know when I speak to parents, I always tell them, clean up your environment. Think about, what are you washing your child's bed linen with? What water are they drinking? I always say, try and get the filtered water. What is your view on drinking water?
Well, any kind of environmental toxin could be a potential problem. And it's not like we all have to try and live in this pristine environment. That's really kind of almost possible from the standpoint of the greater context of where we live, right? You can't really control what goes on outside your home. and chemicals you might be exposed to. But there's things that we can do to decrease chemical exposure in our day-to-day lives, particularly within our homes. So the food that we eat, the water that we drink, the chemicals that we don't use in our own yard, so trying to reduce exposure as much as possible. It's not like we're going to live in a bubble. So clean drinking water is hugely significant. I do a lot of testing through a lab called Great Plains Laboratory that analyzes for environmental chemicals. And I'm shocked sometimes where I see how much chemicals people are being exposed to in various parts of the country and certainly in other places around the world. So you're right, it's cleaning up your environment as much as possible, cleaning up your food as much as possible. And that also certainly means your children's food and children's water. So the more that we can reduce toxin exposure, the greater chance we have and the greater chance our kids have of having healthy bodies, healthy brains, healthy minds. So I'm a huge proponent of that.
I always think about the toothpaste. I think about the shampoo that I'm using. I'm thinking, and you mentioned lead being one of the big causes of ADHD. So I'm assuming that's going to come in the water, could be from corroded lead pipes. What other sources could the lead be coming from?
Well, lead, it's interesting. There was a study here in the United States that were looking at common apple juice. Different types of apple juice had high lead, some of them. There's websites you can actually look up that show you some of the content of what's been looked at. Apple juice can actually be a source of arsenic in some cases. A lot of the products that come out of China, have been, contaminated with lead. So, it's an environmental. I don't see as much here in the U.S. I mean, we're not, our regulatory agencies certainly are not perfect, but they've done a good job at eliminating lead from our environment for the most part, although there are certain areas like Flint, Michigan, over the past couple of years had major lead toxicity in their drinking water. But by and large, I don't see huge amounts of lead here in the US as opposed to other places in the world. I've looked at like kids out of the Middle East, really high lead, kids out of China, very high lead levels. So it's not to say that it's not here. It's just the United States is a really huge country. So there's different isolated areas. But yeah, these are environmental, exposures. And so interesting thing about lead, when you look at some of the data going back many decades, they would actually list certain levels of lead that were considered safe. And as time has gone on, they realized there really is no safe level of lead. And so, I don't know what the stats are in South Africa, but, from some of the families I've worked with and some of the testing I've done with some people there, it's certainly in the environment. And, what we have to, but I think, Ilana, we've got to look at it from the standpoint of, it's not ADHD. It's the same with autism, right? It's not just one thing. So it's accumulative things. And there's certain things that might have a bigger impact on a certain child versus another child. But it's the cumulative load that I see that tend to have the big negative impact. So to hyper focus on just one thing often misses the point in that, when we're looking at environmental exposures, we're looking at diet, we're looking at nutritional status, and these kinds of things. That's where people need to put their focus, is how do we improve function? How do we optimize potential? And we do so by improving our diet, improving our nutritional status, removing the toxins as much as possible, and then certainly other strategies too.
You certainly mentioning those pillars, your pillars to treatment. Now, following the diagnosis, what tests do you recommend a parent should conduct for their child?
Minimally, I would recommend, so there's a few of them. As I mentioned, the Great Plains Laboratory. And the why I like them is that they've got a lot of good tests that give us different insights into things that are happening metabolically in the body that can impact a child with ADHD and others too. So the organic acid test, this is a urine profile that looks at many different markers in the body that can be reflective of underlying biological imbalances. So it's a very complicated test, but it's very good. It's very useful because we know that bacterial toxins and yeast toxins can adversely affect the brain. So that's an absolute must, the organic acids test. Another test I like to do in the early stages of assessment is a food sensitivity profile, looking at immune reactions to food. Now, when you're talking about food, it's confusing because we can react to food in different ways within our body. We can have an immune system reaction to a food, where in somebody else, we might have a chemical reaction to a food. And so some of these things we can't test for every single thing. Like, for example, ADD, ADHD. A lot of these kids are very sensitive to artificial flavoring and artificial coloring. The chemical nature of those kinds of foods adversely affects their brain in a certain way where it obviously affects attention. And sometimes I'll actually see in kids who are consuming certain artificial colors or flavors, and sometimes even happens with natural flavoring, can get very hyper, very impulsive, for example. So diet is a big component. I also like doing a hair metals test. And, to be able to just do a snapshot on heavy metal exposure is important to at least open up that discussion. And it also gives an idea of certain mineral imbalances as well. So those three are kind of where I start. And then we could certainly expand from there, like chemical testing and mold testing and whatnot. So there's sort of a layering effect we'll do with lab testing. But to begin, I like the organic acid, the food, IgG, and the hair metals.
We are now able to actually help parents to access the organic acid test. We have a company in South Africa who will ship the kit to their home. The organic acid test is actually a urine collection. You follow the instructions on the lab requisition form. You put the urine you've collected back into the kit, and the company will actually collect it at your home and will ship it to America to the Great Plains Laboratory. I think this is amazing because I've been in this area for going on 17 years, and nobody did that for me, 15 years ago when I was looking for answers for my son, who struggled very much with his attention, hyperactivity, and a lot more. And so it's actually really not hard to get that organic acid test. And I love that test because it's got 72 markers, and really it's such valuable information. It's so worth doing because it'll also tell you what is current and active, which I've learned from you before, what is really contributing to causing the symptoms of ADHD. And then it helps with a roadmap to treatment, correct?
Yeah. Yes. Yeah, it definitely can be helpful.
Okay, so now one of the characteristics, as we know, and we've spoken about that already, of ADHD is the inability to sustain attention. But a lot of parents say to me that the teacher's complaining, he's looking out the window, he's fidgeting, he just can't sustain his attention for long periods of time. What, in your experience, has worked best when looking for treatments to improve attention? I know every child is going to be different, but are there some common treatments for attention?
There are a number of different natural products that can be helpful for that. As you mentioned, it's not always universally helpful, but that's the same thing with medications, right? So not every medication is going to be 100% effective. Certainly, the use of B vitamins can be helpful. Things like B12, B6, for example, folate can often be helpful because those things are linked to mechanisms of attention. They're linked to the metabolism of certain neurotransmitters like dopamine, which is needed for attention, as well as serotonin and norepinephrine. So, a good B complex is necessary. A lot of times kids have problems because of magnesium deficiencies that can sort of increase the potential for attention problems as well. The lack of essential fatty acids, so omega-3 fatty acids, things that we typically get through fish, deficiencies of that can increase potentials for attention and focusing problems. those are really, really important with regards to just overall brain health. Pycnogenol, which is kind of an interesting product, has been used in some cases with attention issues. I've seen some improvement in things like theanine. Theanine is actually an extract of green tea, helping with attention. I've actually had a few kids who have lithium deficiencies, interestingly enough. So it's not the pharmaceutical lithium that people think about. It's just a deficiency in nutritional lithium, because when you don't have enough lithium in the brain, it can affect B12 metabolism. It can also affect the way certain receptors in the brain function. So I wouldn't look for that magic one supplement, right? You know, what's the one supplement for it? It doesn't really work that way. I mean, every once in a while you'll get a clinical, I call it a clinical hit, where you'll use something that has a really profound effect. But it's a combination of nutrients that seem to have a synergistic effect. And the ones I just mentioned are what come to mind.
My youngest son was definitely showing signs of ADHD, and B complex and magnesium helped him sustain his attention immensely. Yeah. It was dramatic for him. Every child is different. What is the role of protein with attention?
Well, we need amino acids. I mean, so protein is going to be a source of amino acids that we get through our diet. We have what are called essential amino acids and non-essential amino acids. Essential amino acids are things that we have to obtain from our diet. Non-essential amino acids are things that our body can produce or convert on its own. But many of the essential amino acids, like methionine, for example, are part of a greater biochemical system called methylation. And the methylation system is, I mean, it does a lot of things, but one of the things it aids in is regulating chemicals that are geared towards focusing attention concentration, because they have an influence over certain receptors, like with dopamine, for example. So methyl B12 can have a regulating influence over certain dopamine receptors. And we need dopamine in order to excite the brain, in order to engage that ability to focus and hone our attention. So amino acids are a key part of that, you know, but so are the other nutrients you mentioned. So the B vitamins are part of that, and the magnesium is part of that. So they all work synergistically. If we're deficient in certain amino acids, we don't have those precursor chemicals to make the neurotransmitters, the norepinephrine, the serotonin, the dopamine that we need in order to maintain balance in the brain. So our body does an amazing job at recycling compounds. So the one thing I've realized in studying biochemistry is our body does an incredible job at recycling things that's already produced. But we have to constantly be bringing in good nutrition to support that recycling process. And so when we don't have it, we're not able to engage different systems and convert one thing to the next that ultimately goes on to, in this particular case, aid in the brain's ability to attend, to focus, and concentrate. So we have to do our part by feeding our body healthy food and overall good nutrition, so that the machinery and the mechanisms of our body have the substrates it needs to make things work.
I love that you say that, because I speak to so many parents of children with ADHD, and I'll say, what does your child eat for breakfast? There are many of the parents that all say, but he's a picky eater. And I'll say to parents, you know, consider removing gluten and dairy, and let's see what happens to his attention. And sometimes parents are very reluctant. How does gluten and dairy affect ADHD? Like, what is its role in contributing to this?
Well, those foods in certain individuals can interact with different chemical receptors in the brain that, I guess, sort of either downstream or sometimes even directly will affect those focusing and attention centers or capabilities in the brain. So, for example, let's say gluten. For just take that, right? So when you eat gluten, your body can react to it from an immune system standpoint, where it might create inflammation. And a lot of times people might feel kind of crampy, or in their digestive tract might get gas or bloating, but sometimes you can get inflammatory reactions throughout the body. But there are other chemicals, there are other chemical structures in gluten, for example, what are called peptides. And these chemicals don't really trigger the immune system, but they interact with different receptors, like opiate receptors, for example. And so when they interact with those receptors in the brain, it can have a dulling effect. It can affect attention. It can affect concentration. It can affect cognitive function. It's basically like being doped up on an opiate medication, right? So if you take a painkiller that is an opiate medication, right? Well, your attention and focusing can become compromised. It's a similar mechanism, because the foods contain certain chemicals that are causing that reaction. And that's very common.
Yes, there have been parents who have removed the gluten and dairy, and they have seen dramatic improvements. I'll tell you, the challenge in South Africa is to actually access the right food allergy testing.
Yeah.
Which food allergy testing do you recommend? I know that the allergy testing can be very controversial.
So I do the one from Great Plains. It's a food IgG. IgG is a type of immune chemical. I find it to be very accurate. It gives a good representation of this IgG reaction that, when high, indicates increased immune reactivity to that food, which can cause inflammation. And it's a blood spot, so you can do it as a finger prick test. And that's a really great place to start. Unfortunately, there's not like one test that's able to test for every single way that we react to a food. Like I mentioned before, these artificial colors and flavors type of scenario. I wish there was a lab test that tested for every single way that our body, chemically, immune system standpoint, whatever, could react to food. It just doesn't exist in that context. So, but when you analyze foods from an immune system reaction standpoint, see what's high and remove them, you're decreasing that chemical potential in their body that could be causing problems, particularly with regards to inflammation. Because inflammation is systemic. It doesn't just stay local in the digestive tract. If you have inflammation, that inflammation can also affect the brain and affect centers in the brain that, again, we're talking about ADHD, it might be affecting certain dopamine receptors. It might be affecting certain areas in the brain that are concentrated in dopamine or serotonin. So it's sort of like the chemicals, right? We don't necessarily know all the ins and outs of why a certain chemical does what it does, but we know that when we remove it and we clean up our environment, as well as cleaning up our diet, we're relieving the pressure. We're sort of taking out some of the variables that we know can create chemical imbalances in the body and the brain.
So just to summarize that, then, there is a fingerprint test, a finger prick test, yes, available from Great Plains. And, that's quite a simple way to test for the gluten and dairy intolerance. And then really cleaning up the environments and also removing foods such as gluten and dairy, processed foods, the additives, and the colorants, you could see a huge improvement in impulsivity, inattention, hyperactivity, in all the symptoms of ADHD.
Yeah, very much so. And so that's key. In fact, I'd even make the point that when it comes to ADD, ADHD, is you're not going to get very far from a non-pharmaceutical route if you're not tackling diet, if you're not cleaning up the diet, if you're not removing these artificial foods, artificial colors, artificial flavoring, if you're not incorporating foundational nutrition, you're just not going to get very far.
What I love about your recommendation is that that's really getting to some of the root causes of what's causing the ADHD in the first place. Now, in South Africa, definitely, I don't know what it's like in America, but first line treatment is going to be prescriptive medication. And what I also find is parents will tell me, we put him onto this prescriptive medication, and the side effect was that it took away his appetite. So I'll say, okay, you told me that the teacher's complaining, he's tired, he can't sit in ring time, he's not listening to the story, he's not sustaining his attention, and the teachers are complaining. But now he's taking prescriptive medication and he's not eating. So he doesn't eat breakfast, goes to school, doesn't really eat his snack, because side effect of the medication is that it takes your appetite away, gets home at 2 o'clock. That's the first time the child's eating. And I'm thinking to myself, but everyone's wondering why the child is not sustaining their attention. The child's not getting nutrition, and the medication is making the root cause of the actual problem worse. That's just my summary of it.
Well, yeah, I mean, those medications will certainly do that. And that is one of certainly the downsides to those medications. And it's a problem, right? It's a struggle. So here in the US, it's the same, right? So we're mostly dominated by what's considered to be conventional medicine. And, it has its role, it has its place, certainly in society. But that is the first thing that happens here, right? It's very rare that you actually have a conventional doctor say, well, have you ever checked food sensitivities, or have you ever tried to clean up your environment? No, their first impulse is to give a medication. And part of that goes back to your training in medical school, what's emphasized in medical school and your medical training. And also the fact that, a lot of doctors have no more than 10 minutes, to try to deal with something before they have to move on to the next patient, because they're so overloaded in their practices. So that's very common. And it's not to say, Ilana, I'll be honest with you, it's not to say that in certain circumstances, a medication may not be I mean, I've seen some situations where the medications have made tremendous benefit. So I'm grateful as a medical doctor to have multiple things at our disposal to use. My first approach always is to assess things clinically based on whatever kind of patient I'm working with. I want, and then I start working on the foundations and the fundamentals: good diet, healthy environment, good eating habits, all of those things. That to me is essential for everybody. And in doing so, we can many times get great success where a medication is not needed. That's fantastic. And that should ultimately be the goal. There are certain circumstances where even doing diet and these kinds of things, there has been a few kids where they've needed some medication, maybe not as much as they needed, or maybe using it just periodically. And that's okay too. But if we never attempt to do the foundational work, if we don't ever attempt to look at toxins, diet, nutrition, and ever implement those, we'll never know what can happen with a given child. And so we have millions of kids on their first impulse is, oh, your child has ADHD, take this med, right? The parents are never given an alternative. It's never even discussed, never even emphasized. And a lot of times it never gets emphasized because the doctor doesn't have any training in it. And so people just go on and think, well, there's no other options. And that's totally false. There's many other options. So, and I'm sure the same thing's happening in South Africa.
It is.
And other places.
I really think you've given a very fair assessment of the situation. It's also going to depend on the individual child. But what I like about what you said is that you need to try the foundational nutrition. You need to try cleaning up the environment and addressing possible toxicity. And it's just never given as an option. I really like how you explained that. Now, many children with ADHD can also suffer from anxiety. How can this be treated?
Same kind of thing. I mean, the anxiety is that's a huge topic, right? Because, I mean, you just think about this past year of everybody being locked down, and there's a lot of anxiety in general. Mm-hmm. But anxiety, that manifests in kids oftentimes is linking back to, if we were to take it just to the physical level, the same types of imbalances. The B vitamins, the essential fats, the toxins that, again, create chemical imbalances in the brain. You don't have good sustained nutrition to maintain good function. And so the brain is more vulnerable to stress. Now, anxiety can certainly be triggered for other reasons, right? Instability in the home, instability or stress at school or in social circumstances that can, as human beings, it doesn't matter where you are in the world, right? We're human beings. We are vulnerable to stress, and we're vulnerable to these types of feelings. And so are kids and what they see on TV and all these other kinds of things. So when it comes to anxiety, though, it goes back to the same fundamentals. Now, there are some additional remedies that sometimes can be helpful, like something called GABA, G-A-B-A. That is actually a particular type of nutrient that's needed in the brain to regulate against excess electrical activity. It basically has an inhibiting effect on excess brain activity. I think of it like GABA sometimes works like you're turning the volume down, right? You're sort of kind of mellowing things out. Theanine, which I mentioned before, that extract of green tea can be helpful. I've seen anxiety levels decrease with lithium, certainly magnesium. Magnesium deficiencies will increase your potential to anxiety and stress. Same thing with omega-3 fatty acids. So the approach that I've always taken is, regardless of somebody's diagnosis, okay, whatever diagnosis they have, and if we're just talking about children, teenagers, for example, whether it's with spectrum disorders linked to autism, whether it's ADD, ADHD, okay, is let's work on the fundamentals first. Let's work on diet, good nutrition, good foundational supplementation, so that we're filling in the gaps nutritionally, so that we're giving the body what it generally needs to function normally or as normal as possible. Then we can start working on other factors. What other toxins are we exposed to? What other food reactions? Get those removed. And so, the things that we often talk about that help with attention often help with anxiety. And it may be that for some kids, their anxiety could be triggered because they have poor attention, okay? They know they can't focus. It's distracting, so that raises the stress level, particularly when they're in a classroom setting where if they're very aware of the other kids around them, they can feel that they're different. I'm not saying everybody, but they might sense that. And so there's a lot of that internal dialogue and social pressure that gets built in. So hey, one thing I want to mention real quickly. Go ahead, you're going to ask a question, but I have another thought on something I want to mention.
Finish your thought first.
So one thing and I don't know how much people in South Africa or other places around the world are looking at this, but there is a component to this attention deficit ADHD that in some cases could also be what's called an auditory processing disorder. And so it's kind of strange in that auditory processing can look like sort of straightforward attention deficit. The child can't focus, they're looking out the window, but it's not really because they have true attention issues. It's because their brain is not organizing information in a synchronized way. They can hear just fine, right? Their hearing acuity is just totally normal. But when sound comes in the right ear, comes in the left ear, it's not getting synchronized and organized in a cohesive fashion. The signals get mixed up. And so it takes a while for the brain to organize that information. And that little gap is enough to affect attention. That's sort of the classic thing I mentioned is it's like you're sitting in class and the teacher is writing 3 instructions on the chalkboard, right? So they write, instruct step number 1, right? So you sit down and you write step 1. And then you look up and she's writing step number 3. And you go, what happened to step number 2? Right? And it's because that information is not being, and so these kids go through their entire lives that way. They're constantly missing pieces of the information. So what do you do? What do you do? I mean, think about all of us, if we're like in a conversation with people and somebody's talking and it's noisy and you've got a lot of sound and you're not quite hearing what somebody says and you miss certain key points of a conversation, do you generally try to hear more, or do you just say, I'm totally lost in this story and start focusing elsewhere? I think the same kind of thing happens with kids who are not processing that auditory information. And so many audiologists who actually do hearing assessments can also, some of them have additional training in auditory processing. So that's a key component. And one of the things I've seen is that you have a kid who has that classic ADD aspect, and they're put on medication that's supposed to work and it does nothing. Okay. That may be the child who actually has an auditory processing problem that is manifesting or looking like, attention deficit ADHD.
Dr. Woeller, I get excited when I hear you speaking because you just have a wealth of knowledge, and I think what you've said is really so important. I'll tell you, from our standpoint at Catch Up Kids, we use the ABA methodology to assist also with anxiety or auditory processing challenges. With the anxiety, we'll teach the children emotional coping skills. So, again, medication has its place, but a lot of parents think, okay, the child's going to swallow that medication and now all the problems are just going to go away. You do need to be working on actually giving your child those emotional coping skills. And that's also what we do through the ABA. And then with the auditory processing, I think it's such an important piece that you've raised. Certainly, the audiologists can help as well. We will also run certain auditory processing programs for the children to help them to learn to order that information and plan that information better. But it's so interesting hearing you talk about this, because I think it's clarifying a lot of questions that parents have around, why is my child not sustaining attention? And like you said, it may not be that they're not sustaining their attention, may be an auditory processing problem. That's very important, even in the ABA program, if they do enroll their child, because there's certain skills we teach for attention, and there's different skills we teach to improve auditory processing. So all these things can be treated. Now, histamine and ADHD, is there a connection?
There could be. I mean, it's not going to be, in all certain circumstances. Histamine is a neurotransmitter in the brain. It has effects throughout the body. So I would say in certain select cases, it can be a contributing factor. It gets a little complicated when you're looking at some of the genetics, because, there's different enzymes that break down and regulate histamine. But I would say, yes, in general, it can be a contributing factor, not in all cases. Not in all cases.
My youngest son improved his sustained attention when we put him on antihistamines, but the whole histamine issue is very complex, because I know that there's a diet that you can follow with foods that are low in histamine. It's not common. It's, depending on the specific individual child. My son did improve his attention once we started the antihistamines. I mean, I used to even joke and say that his antihistamine is like giving him a prescriptive medication, but that was just, his individual makeup and what needed to be treated. And that's not the only thing we treated. We did diet, and we definitely supported his detoxification system and cleaned up the environment. My son, my youngest, who is in grade 3 in a mainstream school, he has chicken soup for breakfast with gluten-free toast. We're not perfect. We cheat sometimes, but just like, you were talking about, you can see how the kids react to foods. If I give him cereal from a box, processed foods, you can immediately see within an hour he's jumping around, and it affects him. So some kids, you can see it immediately. Others, you can't always see it immediately, but I really do try my best. And when I tell people that we give chicken soup for breakfast, they look at me like I'm absolutely crazy. But yeah, we do. I really do try with that breakfast. Such an important meal of the day, that breakfast. Sometimes I'll send a protein shake. I wish, the teachers will often recommend that the child go onto medication. And I often say that I wish the teachers would be making sure that the kids are eating their snack or drinking their protein shake at break time, because it's so important for their sustained attention.
Very much so. I've actually had a few circumstances where because the child wasn't eating their midday snack for whatever reason, they're off playing, doing or whatever, and they're a total mess by the afternoon because they can't attend, they can't focus, they're anxious. And it's like, well, they're low in blood sugar. I mean, that can happen to a lot of people. So you're right about that, definitely.
How can we improve sleep? So there are some children with ADHD, they can't fall to sleep, they can't stay to sleep. This causes more anxiety for the child, anxiety for the parent, because, we're fighting to get them to sleep and they can't fall to sleep. Sleep is important. We all know that, especially if you've got a test at school the next day. How can we tackle this?
So first off is, again, fundamentals of good nutrition. Okay, that's important. Magnesium at nighttime can help. GABA is also helpful at nighttime too. Our body naturally produces GABA, or our brain naturally produces GABA at nighttime, or should normally. As our cortisol levels drop, our GABA levels come up, and it's sort of like turning off the light switch in the brain. That can help. The same with magnesium. Magnesium is very important too, to have a relaxing effect in the brain. Making sure again, what goes back to the whole diet thing, making sure we're staying away from foods that we're reactive to. So if we're eating foods that are high in sugar, high in artificial colors, flavors, particularly at nighttime, those can have an igniting effect in the brain, sort of like turning on the light switches. So that's important. The other thing is what I call sleep hygiene, and that is setting the environment for sleep. It's not, sitting there watching, TV until 11 o'clock and then jumping in bed, right? Kids need a routine. They need to have things wound down. That could just mean turning the lights down, turning the TV off, turning the electronics in the house off, or, at least in their room. There shouldn't be a TV, there shouldn't be an iPad, there shouldn't be an iPhone in their room, or cell phones that are having electromagnetic frequencies in the bedroom. So basically making their room a place for them to sleep without a lot of, extraneous noise. A couple other things is, simple things could just be making sure the room is dark enough, making sure there's adequate airflow, making sure the room is cool. It's very difficult to sleep in a warm room. And then we get into things that can many times help with chemical inducement of sleep. And that one of the most common would be melatonin. And so people sometimes go, well, I took melatonin, it didn't work. We'll say, well, you think you probably took it not enough, or maybe you weren't taking it at the right time. And in fact, a lot of times with melatonin, you need to actually take it a couple hours before bed, before desired bedtime, to allow it to get absorbed, to allow it to get converted into the form you need. Melatonin is like the molecular equivalency to darkness. So if you take melatonin, you got all the lights on, you got electronics are going, it's not really going to have much of an effect. So it needs to be taken at least a couple hours prior, and that can help. And sometimes, 0.5 milligrams might be enough. Another child, it might be a milligram, and others it might be 2 milligrams. So melatonin often is helpful, but it kind of gets back to some of the fundamentals of lifestyle too.
And with the melatonin, slow release, I found that the slow release works the best. And also with the melatonin, am I correct in saying that our bodies naturally make melatonin towards evening? And if there's a metabolic imbalance that's resulting in your body not making that melatonin, then we need to supplement it. Would that now be for a temporary period of time while we're trying to work out why the body's not making melatonin? Because there's probably a lot going on behind the fact that the body's not making the melatonin.
Absolutely. Yeah, it doesn't have to, people shouldn't think of these things as a, something like melatonin forever, right? I mean, but it's certainly appropriate in the interim time while you're working on other things, is to use it. If your brain is deficient in it. The other thing, melatonin is an antioxidant. It actually has immune regulatory activity. In fact, in some of the COVID protocols, they're using very high amounts of melatonin. So it's very important for sleep, but it's also a very important antioxidant in the brain. So yeah, all of these things are viewed like melatonin, to use it for a period of time while we're working on other things. That might be 2 months, that might be 4 months, that might be 6 months in certain circumstances. It's difficult for me to give an exact time frame. People often ask me, well, how long do I have to use this supplement for? I'm like, well, as long as it keeps working. Everybody's a little bit different. So my feeling is when you're working on lifestyle, you're working on diet, working on nutrition, these are fundamental changes that you're trying to do to just improve your own personal health if you're doing it as an individual, or your child's health. And these are hopefully things that would be done for years, if not forever, in many cases. But, in the early stages, I think it's oftentimes easy to kind of wrap your mind around, okay, over the next 3 to 6 months, we're going to be working on these, or 6 to 9 months, we're going to be working on these factors. And ultimately, like Ilana, the fundamental changes that you make for your family and your kids, probably when you started off with certain things, is like, okay, I'm going to try this for 3 months. And then it became something that you've done over the last, 6 to 8 years now, or however long it's been.
Oh my goodness, years and years. My oldest son, David, he's been taking melatonin. If I had to tell you how long, I don't know how long it's been, like years.
Yeah.
I was speaking to a parent yesterday whose child was diagnosed with ADHD, and she told me that she'd been to see a doctor who'd, of course, put her onto the prescriptive medication for her son, and he'd been on it for a couple of weeks, and then he developed a tic. Is this something that you've heard of before?
It can happen with some of the medications. You'll sometimes see that with what's called antipsychotic medications, risperidol, for example. It's, tic disorders develop, whether it's a vocal tic or a motor tic, involuntary movement. You're getting some kind of imbalance happening in a certain part of the brain called the basal ganglia, or components that are around that. It's not, in my experience, it's not real common, but it can happen. So, and again, it depends on the medication. There's a lot of different kinds of medications, and how they work mechanistically. But that is a side effect of certain things, is tic disorders. So fortunately, it's not universal, but it can happen.
Dr. Woeller, it's been wonderful to speak to you today, and we've learned so much about ADHD. Thank you so much. If parents want to get in touch with you, I know you know that you are available to parents internationally around the world. You work with children on the autism spectrum. You work with children with ADHD. How can parents get in touch with you?
A couple ways. Directly through my practice, if people want to have a direct one-on-one consult with me, mysunrisecenter.com. So mysunrisecenter.com. You can easily Google my name, and you could just say Dr. Woeller private practice, and my website will come up. There's another way that people can interact with me too. So we have a website called Autism Recovery System. And this has been online for many years. It is a membership site where parents can join and post questions to me through an interactive forum. And there's also videos and articles in that site, and I can, answer, questions for people. And I don't want people to think, oh, because it says autism recovery system, that it wouldn't be appropriate for a parent who has a child with ADHD. I have plenty of parents who are part of that website whose kids have ADD, ADHD, who use that site to post questions to me. So don't let the autism, shy you away from using it. We developed that website really because the autism community is greatly underserved in many cases. But when you look at these situations, right, if you take the sort of the classic autistic kid, and then you take the child with ADHD or attention deficit, it's not as though the ADHD child has autism. Some of the autistic kids have ADHD, but the underlying aspect that we've been talking about, okay, food sensitivity, nutritional imbalances, magnesium deficiencies, essential fatty acids, the organic, all of that applies to both groups and other kinds of people, because we're looking at the underlying fundamentals of health in the body and the brain. So that is really probably the best place that people can interact with me on a daily basis, is through the forum of Autism Recovery System, even if your child doesn't have autism. I have many parents who are part of that whose kids are not autistic.
I like how you explained that. And what I tell parents as well is that it's all the same causes. The injury is just different. So the child with ADHD is presenting differently to the child with autism, but there's a lot of overlaps in the causes of ADHD and autism.
Right, exactly, yes. I mean, there is a lot of overlap. And the way it manifests might be different, but the underlying causes, are, the same or similar. So
Exactly. Well, it's been wonderful to speak to you. Thank you so much for an informative podcast. We hope to speak to you again soon.
Thanks so much, Ilana. My pleasure.